Thank you, Mr. Speaker. Colleagues, I am proud to present HB 5025 today. HB 5025 is the budget bill for the Oregon Health Authority, which combines most health-related programs into a single agency to improve health of all Oregonians, increase the quality of healthcare services provided, and containing the growth of healthcare costs. OHA also administers publicly funded health benefits and contracts for services with insurers, CCOs, medical providers, local governments, tribes, and community-based organizations. Colleagues, the Joint Committee on Ways and Means approved a budget of $41.7 billion in total funds, which includes $6.2 billion in general funds, and just under 6,000 FTE, which about half of those work in the Oregon State Hospital. The general fund budget is a 12.1% increase, largely reflecting Medicaid caseload cost increases, declining marijuana and beer, wine tax, tobacco, and cider taxes, and investments in patient and worker safety. The investments in this budget support working families, addiction prevention and treatment services, dental care for veterans and children, and general healthcare services for providers when healthcare services are being cut at the federal level. Colleagues, I'm going to walk through some long lists of significant investments, but I do think they are important to share here on the floor given the massive amount of dollars that we're spending here, and we'll start with enterprise-wide costs. We are updating the mainframe, making it more modern. This package provides increased budget authority to continue work that began in the 2023-25 biennium to migrate certain benefit eligibility programs and provider payment processing from older mainframe computer systems to more modern platforms, including cloud-based platforms. In PEB and OEB, we know that the majority of these funds, all of these funds are funded through other funds, through premiums collected through all insured providers. OEB administers medical, dental, vision, and other benefits for Oregon's school districts, community college, and education service districts, supporting 256 employer entities. Cities, counties, and special districts are also eligible to join the OEB benefit program. Two specific investments that I want to flag in public health addressing access to women's reproductive health. One is a one-time $10 million general fund appropriation for distribution to providers in response to reductions in federal funding for healthcare services. The intent of this funding is to prioritize the highest volume providers operating across multiple counties in the state. And the second one is a follow-on grant to Seating Justice for $2.5 million for patient navigation services to providers to upgrade facilities in response to an influx of out-of-state patients seeking care in Oregon. At the Oregon State Hospital, we are investing a total of $56 million general fund to continue addressing Centers for Medicare and Medicaid Services corrective action plans, patient safety, workload, and staffing issues, and to address compliance with timelines to provide court-ordered restorative services. $21.8 million general fund and the authorization to establish 76 permanent full-time positions to address identified operational deficiencies that, colleagues, I know we all care about and that we've all been reading about and want to make sure that we are addressing. This budget does just that. In Medicaid, we have quite a few investments as well. We are based on some of the work that we did previously this session. We have enhanced hospital maternity rates, a one-time appropriation of $25 million general fund matched with $64.3 million federal fund expenditure limitation for a total of $89.3 million to support enhanced hospital maternity payment rates. Earlier this session, we passed HB 2010, which was the provider assessment extension. And as you remember, this package recognizes the budgetary impact of extending the provider tax assessment on hospitals back earlier this session. We also are including an adult mental health residential rate increase. The general fund is increased by $9.6 million and increased federal funds expenditure limitation of $14.4 million for costs associated with the update to adult mental health residential rates. We also are including a tribal set-aside for clinical training. This package reestablishes $3 million general fund that was reduced from the state agency's 2023-2025 budget as part of the spring 2025 rebalance. The agency determined that $3 million of the $15 million total general fund appropriation provided in House Bill 3396 of 2023's session for clinical trainings should be dedicated to tribal operations. So this effort is going to advance tribal clinical training offerings that had required an entirely separate process to establish this program, which has caused delays in extending the need to carry over funds into the 2025-2027 biennium. And again, in the Medicaid sector, we have mobile health unit transfer for behavioral health program to Medicaid program. Back in 2022, HB 4052 established a pilot program within OHA to operate 2 culturally and linguistically specific mobile health units to serve populations with histories of poor health or social outcomes. This one-time extension of funding for 18 months is in the 2025-27 biennium. To complete the pilot program is transferred from the Behavioral Health Division to this Medicaid division. Just a couple of more programs, colleagues, in behavioral health. We know that this has been a priority not only for this agency, but for this body. We are pleased to be continuing to invest in the deflection and diversion funding that we stood up last session, specifically $13.2 million of general fund to continue deflection and diversion program funding that had been provided on a one-time basis in the prior biennium. Of the total $9.8 million, we are providing distribution to community mental health programs to support the coordination and provision of services for deflection programs that assist individuals who may have substance use or other behavioral health disorders to access treatment, recovery support, housing, case management, or other services to prevent interactions with law enforcement, lead to conviction and incarceration, or any other engagement within the criminal justice system. We also are including $7 million general fund to expand the intensive in-home behavioral health substance use disorder model to youth with substance use disorder and recruit providers to work under this new model. And importantly, a $2.4 million investment of general fund and the establishment of 1 permanent FTE to help people on the aid and assist orders at the Oregon State Hospital to navigate their transition back to the community. These are new behavioral health community navigators, colleagues that are supporting our work in the aid and assist and at the Oregon State Hospital. And this package also includes $10 million increase for aid and assist services. We also are including $1.5 million general fund for statewide civil commitment coordinators, $10 million for the harm reduction clearinghouse grant, and $10 million, which I'm particularly excited about, to expand behavioral health residential treatment and support services for youth. Colleagues, I know this has been a long floor carry. There's been a lot in this bill. Thanks for continuing to hang on here. I think what I want to leave you with is, again, this is a $41.7 billion budget for the Oregon Health Authority, which invests in many of the significant issues in our social and healthcare services, including maternity access, including strengthening our workforce, especially our behavioral health workforce, particularly now in a moment when we could potentially be heading into a recession. We want to make sure that we're continuing to offer safe patient care, safe workplaces for our staff, and affordable and accessible healthcare for all. It took many individuals and hours to finalize such a massive budget that addresses the shared commitment of us to improve the health of all Oregonians. So I want to thank my co-chair, Senator Campos, and the rest of the subcommittee members, Representatives Pham, Deal, Scharf, and Nelson, and Senators Gelser, Bluen, and Hayden for engaging almost daily throughout this legislative session, the Oregon Health Authority staff, the LFO staff, and the hundreds of Oregonians who took time out of their days to either show up in person to testify, to submit written testimony, or to email or meet with us personally in our offices that made these significant investments possible. So colleagues, I urge and I vote.